We're going to explore today the impact of cannabis use on psychosis risk, relapse, and outcome. We're going to start at the ground floor here. What is cannabis made of? And you may think you know, and that's great. It is a really kind of complicated drug. It has lots of different component parts to it. I'm sure most of you are familiar with THC. That's one of the main components of cannabis. It's the part that makes you feel high. It also contains cannabidiol, CBD, which is now one of the main kind of advertising points, I feel like, for a lot of products that people put forward with cannabis with purported medicinal properties. So you've probably seen CBD all over the place. But then, there are over 140 other parts of cannabis, other cannabinoids that are there in the plant that may or may not make it into the product that you smoke or eat or otherwise, but it is a drug with a lot of different component parts that we may not think about. And you can use cannabis in a lot of different ways. The dried flower buds, you can smoke, you can put in a vaporizer, and those tend to range in the lower concentrations of THC, right? So that can range all the way from like 4 or 6%, all the way up to 30% THC. Can be formed in resin, sort of hash cakes, and the THC concentrations there can range from quite low in certain parts of the world, actually, to very high concentrations of THC. What we're seeing more often, in the past, 5-6 years, has been an increase in the use of extracts. So oils, waxes, people dabbing, right? I'm sure you're familiar with. These are really high concentrations of THC, ranging up to 90+% THC concentrations in these products. And then finally, we have edibles. So you can eat THC in lollipops and gummies, and you think of it, and you can find THC inside of it. So that's kind of your basic intro. This is something that I think is really interesting that you may not have seen, is that there are so many other ways that cannabis can be concentrated, right? So you can concentrate it into crumble or batter, shatter, distillate, this is what's most commonly used to make vape cartridges that people will use. You can form crystals, rosin, hash, so many different ways that cannabis can be consumed. And I think this, to some parents, this might be a surprise, right? You think of joints or smoking out of a bong or things like that. But there are really an endless possibility of ways to consume cannabis nowadays that it's good to know.
So I think for me, as I started learning about cannabis, which has been an ongoing journey, these words that he is saying are very important for us to know. Because when you're saying, like, are you smoking bud or leaf, right? Versus are you smoking batter, wax, or dab? That is like totally different concentrations of THC. Like even flower can be 30% THC, but when we get to wax, like you're talking about like 3,000% concentrated THC. Folks will get way higher and stay higher for longer at that concentration than if they're smoking flower with their friends once a week.
There have been interesting studies where they watch how people smoke and consume cannabis. And if you give someone who's an experienced user, you give them a joint, for example, or a pipe, with flower for them to smoke, they automatically kind of titrate how they use the cannabis. So as they get more and more high, they tend to take shallower breaths and tend to kind of recognize, oh, I'm feeling more high, maybe I should back off a little bit. But when you come across these concentrates, it's much more difficult to do that. You're getting such a strong concentration right away into your bloodstream that it's more difficult to back off and say, oh, I'm too high, I should maybe not take another puff. So that's worth noting too, when you're kind of thinking about managing use. Is there a way that they can change how they're using? If you can't eliminate use altogether, are there other ways that are less harmful? So contrasting the two main components of cannabis, THC and CBD. So THC is our main psychoactive component. It makes you high, it makes you feel high. A lot of people report using cannabis because they feel like it helps reduce their anxiety. They want to feel calm. They say that cannabis makes them feel calmer. And in fact, some low doses of THC do seem to reduce anxiety to some degree. But there is this curve that happens, this sort of biphasic response of the drug, where as you get into higher and higher doses of THC, it actually causes your anxiety to ramp up. So people who tend to use cannabis may not recognize this, or maybe they do implicitly, but But it is something worth noting that low doses might see one effect, but you might see a different effect in your mood as you increase how much you're smoking. And then one of the main reasons that we're here to talk about today is that THC does put you at risk for experiencing hallucinations and unusual thoughts, like of the delusional quality. You can give healthy people who don't have a mental health diagnosis cannabis, and they can experience hallucinations and experience paranoia and things like that. And then on the other side, we have CBD, which doesn't have any psychoactive properties, does not make you high. And there are a lot of clinical trials trying to look at where it might be beneficial. You know, there's a lot of that is still kind of to be determined at this point, but it is really a compound that we think might have some beneficial properties. And it has we've been looking at anxiety, social anxiety, potentially has some anti-inflammatory effects. It may have some antipsychotic properties, and it has been FDA approved as an anticonvulsant for people with really extreme epilepsy. And that is the only approval for CBD currently, is as an anticonvulsant. What's less well known, I think, is that it does have some side effects. So if you take big doses of CBD, you can get somewhat tired. You can it can affect your sleep, and it can have big effects on your GI system. So that's sort of a contrast of THC and CBD. And I added these slides in here just recently because it seems like a new day occurs and there's a new type of cannabis that emerges, right? K2 or spice, you know, these are sort of synthetic cannabinoids. They mimic THC to some degree, but they're much more dangerous. So people have really extreme psychosis and even have died from taking spice. It's quite a dangerous compound. So let's just talk a little bit about how cannabis has changed. It used to be that cannabis that you would purchase or get from the guy down the street, you know, in the 70s and 80s had a fairly low amount of THC, so in the range of 3 to 4%. But as you can see, you know, starting around the year 2000, the THC concentrations in the cannabis we use skyrocketed, and now you can regularly find, I should change this, it's now regularly above 30% actually of what you can find most products and dispensaries, the amount of THC. What we've seen as well is that the amount of CBD has really dropped in cannabis. So you're sort of increasing the THC concentration at the same time that breeders who've been making these plants have sort of bred out the CBD as well. So you're getting more THC to CBD in the product that you're buying. So before, it used to be about 10 to 1 of THC to CBD. Now, you know, it's more like 120 to 1. Hardly any measurable CBD in the products that people would buy, you know, from a dispensary or get from someone else. So that means kind of this other side of cannabis. So CBD, we think, might have some antipsychotic properties that might, you know, kind of work against some of what THC produces. You actually get very little of it now in the type of cannabis that you smoke. Kind of a take-home message about this: it's worth knowing what these two compounds do. They're very different, and you know, kind of just understanding their general concentrations in the product that you would find, and the fact that the cannabis that we smoke today really is different from what has been around historically, and it is much more powerful. And the thought is that, you know, these higher concentrations of THC that we have in current cannabis potentially has a much greater impact on our brain and ultimately our behavior. So let's talk a little bit about that. We should know that cannabis does affect our biology, and the use of cannabis affects it. So I've talked to a lot of different families, and it's not always really well recognized that smoking cannabis during pregnancy can be dangerous. I think some people don't realize that, right? But in fact, some of these compounds do reach your developing baby. Most of this research has been done in animal models, you know, where they might expose a pregnant mouse to cannabis. But they do find that the infants that are born to these mothers that have been exposed to cannabis do have some unusual behaviors. You know, their emotion regulation is disrupted, cognition and ability to think is disrupted, and you see effects on the brain as well due to smoking during pregnancy. You can also expose your baby to cannabinoids via breast milk. So if you're smoking cannabis, maybe you're self-medicating for dealing with the, you know, lack of sleep and a crying baby. I know I experienced a lot of stress when our children were born. But your baby would be exposed to those cannabinoids via your breast milk, and we have seen research where it does impact brain circuits of babies who are exposed after birth. And these are typically brain circuits that are involved in things like motivation, inhibition, things like that. And it's affecting these parts of the brain that we actually see that are impacted in psychosis. So there's this sort of overlap, in the areas that we see that are disrupted in psychotic disorders and areas that cannabis seems to impact. And that's part of why we think that cannabis puts people at risk, for psychosis. And then finally, this is probably the most relevant for a lot of our clients, is this adolescent exposure. So during adolescence, is you can kind of think about it as this is the time where our brains have actually kind of over-connected. We've made more connections than we need in our brains as we're developing children. And then in adolescence, your brain is going through this process where it says, okay, I don't need these connections anymore. Let me get rid of them. Let me just focus in and get a finely tuned brain that just has connections that I need. And so one of the thoughts here is that the impact that cannabis is having, if you're using it during adolescence, it may actually cause over trimming of these. So you're sort of clipping off too many connections, which can be detrimental. And then ultimately, the biggest risk of using cannabis during adolescence is the risk of psychosis, an increased risk of developing a psychotic disorder. So I will dive into that next. So people who have a psychotic disorder, cannabis really is the preferred illegal drug. Alcohol is, of course, up there as a preferred drug of choice. But in terms of federally illicit substances, cannabis is at the top. And anywhere between 20 and 70% of our clients with schizophrenia have some cannabis use, with about half reporting recreational use, and about a quarter eventually developing a cannabis use disorder. So it's very common. And I think that's why it's always at the top of people's lists, so wanting to learn more about. But what we have learned over the past 20 plus years is that, and this has been repeated across a number of different studies, I've just sort of made this graphic kind of distilling a lot of the information that we know. But use of cannabis does significantly increase your risk of developing a psychotic disorder. So this was a study that was conducted in the UK, where they basically tracked people, what types of cannabis they used and how strong the cannabis was that they were using. And what they found is that people that tended to use stronger cannabis were much more likely to show up at the hospital with a psychotic disorder. And in fact, if you were a daily user of strong cannabis, you had over 5 times greater risk of ending up in the hospital with a psychosis compared to those who never use cannabis.
Would you say that the majority of weed that is grown now is still genetically modified to be, as you have labeled here, strong cannabis?
Well, absolutely. I mean, you'll have a harder time finding weak cannabis. I mean, I think that's the thing, right? If you were to go to your average dispensary nowadays, you would have to, really specifically seek out those other strains of cannabis that usually are marketed more for sleep aids, or I have arthritis and I have chronic pain, or I think sometimes they'll do lower THC varieties with higher CBD, and I think that's the marketing ploy, for the lower strength cannabis. But I think most often, if you were to go and grab something off the shelf, it's going to be a high potency THC variety. But I think to add to your point, right, I think what we would say to that dad is that, sure, you came through this okay, right? You're able to smoke cannabis, you don't experience psychosis. And in fact, a lot of people can smoke cannabis and they don't become psychotic, right? That is absolutely true. However, there are a subset of people who, partly through genetics, partly through early life experiences in utero, or post-birth, like experiences or exposures to stressors or malnutrition, any number of factors, right? You have all of these things that are coming into the equation for some people. And for some people, when they are exposed to cannabis, they do become psychotic, or they can have, significant symptoms that emerge from it. And I think what we have to stress to people is that, do you really want to risk you being that person, right? If you have a family history of psychosis, is this really, in terms of a risk benefit ratio, are you getting so much out of cannabis that it's worth it to you to risk these really adverse symptoms? And what I'll get to later is that these symptoms can actually cascade into a lifetime psychotic disorder. So yeah, I think it's a combination of the strength, but also these other factors that you're entering this world with, and that you enter adolescence having been exposed to, right, that put you at greater risk as well. There have been a lot of studies as well that have looked at how cannabis use might impact your outcomes depending upon when you use it. So I mentioned that kind of critical adolescent period where there's this period where our brains are going through a lot of different changes and pruning away connections. And what has been found is that the earlier you use cannabis, the worse your risk for developing psychosis. This is just trying to illustrate, someone who uses cannabis before age 15, has almost a 5 times higher risk of developing psychosis, whereas that risk goes down a bit if you're using cannabis before age 18. And then if you've never used, your risk is at a 1. But the earlier you start using cannabis, the higher your risk, and generally the more dangerous it has for a negative outcome. So even if your cannabis use isn't associated with or kick off a psychotic disorder per se, we do know that using cannabis increases your likelihood of having what we call psychotic-like experiences. So these are, attenuated symptoms of psychosis, not a full threshold psychotic episode, but having unusual experiences like hearing things that you wouldn't normally want to hear. And to some degree, adolescents have some of these experiences, right? It is somewhat normative to have some psychosis-like experiences. But what we would expect as you work your way through adolescence, here ages 14, 15, 16, we would expect these PLEs, these psychotic-like experiences to go down. We expect them to go down as you get older, right? But in this study, they tracked, hundreds of adolescents and their cannabis use. And those who use cannabis weekly actually saw them increase, and quite a bit. And those increases lasted even for years after they stopped smoking. So this is just to illustrate that even if you have someone who says, well, like, I don't get psychotic when I smoke cannabis, well, at least the data suggests that maybe you didn't become fully psychotic, but you're more likely to continue to experience some unusual things like hallucinations, maybe subthreshold paranoid symptoms that are increasing in comparison to your peers, who aren't using cannabis. I know some families will ask, well, CBD, it seems to be really good. Can I give CBD to my child? Will it help with different things? So they have looked at CBD and to see if it was effective to treat psychosis. And there have been 3 studies as of the last time that I was able to look. An early study compared CBD to an antipsychotic. Other studies have sort of added CBD on to normal treatment. And I will say it's pretty mixed. So these are, one study showed that CBD was somewhat effective. Another one actually showed that there wasn't a benefit, and actually it made people a little bit more sedated. So the jury is very much still out on whether CBD is at all effective for, helping with our psychotic symptoms. And the challenge here is that, these are hard studies to do. Historically, very few people are in these studies, about 20 people in each group, which really isn't enough to give us a whole lot of confidence. And I think the challenge is, I've talked about CBD maybe being an anti-inflammatory and helping with, intractable epilepsy, and maybe it could be, a potential antipsychotic, right? So you might ask yourself, well, and given the marketing, why don't we hand out CBD to everybody? And the challenge here is that these are very small studies, they're lab controlled. The challenge with CBD at this stage, there's such a small amount of research that we really don't know like what amount of CBD would help treat something, right? So if you go to a dispensary, you're most commonly going to find CBD gummies that I have here in the corner. So here we have a bottle where each little gummy is 25 milligrams, right? If you were to look at studies where they treated people with epilepsy with CBD, it's around, 600, 800 milligrams, right? So you'd have to have a couple of bottles of these each day, right, to meet that level of CBD. And then you start getting lots of side effects, right, like diarrhea and fatigue. So there's really no idea of what a dose would be to try to treat, some of the symptoms, or to try to treat that might have anti-inflammatory effects. And to add to that, the CBD that you can buy at most places really isn't very well regulated, right? It might not have the CBD that it states on the bottle. It might even have some THC in there, which you don't want usually. And I think that there was a recent article that came out, I think it was actually in the news that I saw the other day, where the state is having to deal with some issues with testing facilities not being fully transparent about the way that they test samples that go into dispensaries. And so in fact, the THC concentrations that you see on the labels that give you to the decimal point how much THC you might find in what you're going to smoke or consume are maybe not completely accurate. And that there's a push by a lot of labs and manufacturers to try to get the highest THC possible, in what they sell, because it sells for more. People are more interested in buying it. So there's this kind of labeling testing issue in what we're buying that really makes this area pretty murky. So how does cannabis affect cognition then? And I'll just briefly touch on this. If you put someone in the lab and you have them smoke cannabis, or you give them THC intravenously, maybe you won't be surprised that it doesn't help them think better. It does impact their cognition generally negatively. People's learning, their memory, your inhibition, your attention, your processing speed, how quickly you're able to kind of think through things. All of that declines when you're high, basically, which you're probably not surprised by. There's some indications that people with psychotic disorders might be extra sensitive to this effect, but we still need some more research on that. And then long term, so what about if someone's smoking cannabis for years and years? How does that affect your thinking, your cognition? And what has been found in longitudinal studies and other studies that have sort of looked back at people's historical levels of use, they found that people who tend to use cannabis regularly, score lower by about 8 IQ points, basically, compared to people who don't use cannabis, which, I think no one particularly wants to lose 8 IQ points, right? And I think it's important we keep this in mind. I guess the silver lining here is that a lot of studies have shown that if you stop using, some of that will come back. So there's this idea that if you discontinue use, you can recover, some of your cognition back closer to what you started with. So that's, I think, is really encouraging. And in individuals with psychosis, we see something similar. You do have this negative impact related to continuous use of cannabis. And if you look at impact on the person's symptoms, you do see that the more people tend to use cannabis, the more often they're in the hospital, the longer time they spend in the hospital, and shorter time until they relapse. So part of what we think might be related to that is that there's some indications that cannabis use makes you a little less likely to adhere to your normal medication regime. So you're more likely to skip a dose or forget, but potentially to take some of your medication. And then that might actually make you more likely to have symptoms. In fact, this has been looked at over time in a few different Scandinavian samples, where they actually found that they looked at a sample, everyone who'd been diagnosed with a cannabis-induced psychotic disorder. They then followed them over 20 plus years. And what they found were that over half of those people who were initially diagnosed with cannabis-induced psychosis actually were given a schizophrenia or a bipolar with psychosis diagnosis years later. And this was actually half the cases we're transitioning into primary psychosis or mood with psychosis, actually within the first 5 years, the first 3 to 5 years. You didn't need to wait 20 years for this to happen. It was happening relatively rapidly. The short answer to this is that, I talked about THC concentrations going up. We do see evidence that cannabis-induced psychosis rates are going up significantly. There's also evidence that psychosis caused by cannabis use rates have been going up and quadrupling. So there's a lot of new evidence that cannabis is making things a bit more complicated for us who work in this field.